Hello, this is Lauren Sanfilippo from the Office of Clinical Trials Administration, also known as OCTA or OCTA. In this video, I'm going to take you step by step through creating and submitting a new contract proposal to OCTA and Kuali Research. What I recommend you have in front of you is the OCTA Kuali Proposal Guide for Department Research Administrators. This is what I have up on the screen for you. You can download this from our website. This is a really helpful tool that has some introductory tips, which I'm going to talk about in a minute on the front page, along with step-by-step instructions on what fields and you need to complete, what information to enter, and it's going to take you through in the preferred order that you should complete and submit information in a Kuali proposal. So on this first page, you'll see we have some tips, and I'm just going to highlight a few of them. The first one is in the section 2. You want to make sure before you go through all the work of submitting your proposal in Kuali that the contract that you're submitting is within OCTA scope if you're intending to submit the contract to OCTA. So in order for OCTA to negotiate an agreement, these 3 criteria right here need to be met. The first criteria being that the entity or entities, if there's more than one sponsor, who authored the protocol must be a for-profit company. There can be no UCPI involvement in the design or authorship of the protocol. So if you have a protocol and a UCSD or another UC investigator had a part in designing or authoring the protocol, and it's an investigator-initiated protocol, that would be something submitted and negotiated by the Office of Contract and Grant Administration, also called OCTA. Another scenario that you might come across is a scenario where an investigator from another university or another medical center authored the protocol, or perhaps a nonprofit consortium authored the protocol. In all of those cases, along with the case where a UC investigator authored the protocol, those are considered investigator-initiated protocols and would be handled through the Office of Contract and Grant Administration. But if you have an industry-authored protocol, you can submit your contract through OCTA as long as these other 2 criteria are met. The second criteria being that you have a study that is 100% funded by a for-profit entity. So you want to make sure that the study doesn't involve either in whole or in part government or nonprofit funds. And then you want to make sure that the proposed study activity is human subjects research. So if all these criteria are met, OCTA can negotiate your contract. The next big thing you want to make sure is when you're sitting down to prepare your Kuali submission, you want to make sure that you have the appropriate documentation and information that you're going to need. And so we have this list here. For an industry clinical trial, you're going to have a sponsor authored protocol, and so you're going to need to have a copy of that protocol. You're going to need to have a copy of the draft ICF or informed consent form. This can be the sponsor's initial draft ICF, or if you've created the UCSD version, either one will work. And then in an industry clinical trial, typically the sponsor asks the university to work from their sponsor template. So you're going to want to attach a copy of the sponsor's draft contract for OCTA to review. And then if the contract does not already contain the draft budget or the draft payment schedule, you'll want to make sure that you request and obtain a copy of that from the sponsor separately and upload the draft budget and payment schedule as a separate attachment if it's not already contained in the draft contract. And then depending on your PI, you might need to upload a document explaining the PI's eligibility, or perhaps a completed PI exception request form if needed. And then the last piece I want to mention is about budget services. It's assumed that if you're submitting a proposal, the PI or the department is negotiating the budget for that proposal. If you would like, you can request the Office of Coverage Analysis and Administration to negotiate the budget. They offer budget development negotiation services. To request their services, as we'll go through later on in the presentation, one of the research questions asks whether you would like to request budget services, and you can do so by selecting the option that says, I request OCA budget services. But I just want to highlight that this is an optional election that you have to proactively make by answering the question correctly in the research questionnaire. Otherwise, it's assumed that the PI or the department is negotiating the budget for your proposal. So again, as I mentioned, you'll want to have a copy of this proposal guide. You can download it from our website. It gives you the link to Kuali here and takes you step by step through all the different fields, how you're going to enter information into that field, and then has some tips at the end. So I'm going to go ahead and close the guide and navigate to Kuali. And I'm going to log in with my business systems. And so once you log in, you should see a screen that looks like this. You'll see these different tiles or cards saying Research Home, Conflict of Interest, Protocols. To enter the Kuali Research module, you're going to want to click on Research Home. And in this, you'll notice that the screen lands on the dashboard, but we actually want to come over here to the left and navigate to the Common Tasks panel, which is this clipboard with a check mark icon. So we're going to click on Common Tasks. We're going to go down here to the Proposal Development section, and we're going to click on Create Proposal to create our proposal. And on this first Create Proposal screen, you have to complete all of these fields and click Save in order to start and create a saved proposal record. So we'll go ahead and follow the proposal guide instructions. For a new contract, the proposal type is always going to be new. And then in lead unit, you would select the lead unit, the unit that is sponsoring and financially responsible for the study. For this demo, I'm just going to select the medicine. For activity type, for clinical trials, you'll be selecting clinical research as your activity type. The project date section, these project dates are more relevant and important when it comes to traditional kind of grant proposals. For industry-sponsored clinical trials, there aren't typically firm start and end dates. So in order to help you efficiently get a proposal submitted through the system, we ask that for the project start date, you enter today's date. So we're going to do that here, May 4th, 2020. And then for the end date, we ask that you enter a date that is 1 year and 1 day earlier from today's date. So it's going to be May 3rd. There it is, May 3rd, 2021. And then for the project title, you want to copy and paste the protocol title directly from the sponsor protocol. Here, I'm just going to put protocol title, but again, you would want to copy and paste the protocol title from that sponsor protocol over into this text box. Here, you're going to put the sponsor name. For this demo, I'm going to just use Pfizer. And then the sponsor deadline field is really geared more towards traditional grant proposals that have firm and hard deadlines. This field is not going to apply for industry clinical trials that are submitted to OCTA, but it's a required field, so we have to submit it. So we say to please enter a date that is 3 months from today's date. So we'll just go ahead and enter, we'll enter August 4th, 2020. The sponsor deadline type, again, we don't want to select hard deadline because there's no hard deadlines for OCTA contracts. We want to select internal deadline, and then the anticipated agreement type for an OCTA clinical trial is always going to be contract. So we're going to click Save and Continue once you've completed all these fields. And you'll notice once you click Save and Continue, it will say document was successfully saved here on the upper left-hand side. And you'll see that now your proposal has been assigned with the number. So you might want to write that number down. If you were to click Close and exit your proposal, you could go back into Common Tasks, search for the proposal by this proposal number, and pick up where you left off and continue completing your proposal. If this is a COVID-19 proposal, meaning a proposal that is being submitted in response to COVID-19, you're going to want to click this button and follow the prompts to select the appropriate keyword, which is going to be, let's see if I can pull it up, which is going to be this in response to COVID-19 keyword right here if that applies to your trial. We're going to go ahead and just leave that blank for ours. As you can see in this proposal details screen, it pretty much pulls over some of the information that we entered on the original create proposal screen. The only additional thing that you need to look out for here is there's this additional prime sponsor code field. You'll notice that we entered Pfizer originally in the sponsor code, but there's this additional field which is there in case you are contracting with a clinical research organization, or also called a CRO, or if you're contracting with an academic coordinating center. The name of that academic coordinating center or that CRO, if UCSD is contracting with them directly, is going to go in the sponsor field. So for example, if the contract was with PPD, but the protocol was authored and funded by Pfizer, we would put PPD here in the sponsor field as the one that we are contracting with, and Pfizer would be moved down here to the prime sponsor code field. If we are contracting directly with Pfizer, then Pfizer would stay in the sponsor slot. We will go ahead and for this demo say that we are contracting with Pfizer directly, so we'll leave Pfizer there. We're going to go ahead and click save. No further changes are needed to this proposal details screen. You want to make sure that you click save as you complete each screen. If you click save and continue, it's going to bump you down to the next panel automatically. I don't recommend that you click save and continue because I want you to follow and complete the proposal in the order of the OCTA proposal guide, and so we're going to kind of move around. We're not going to follow the exact order. So I recommend that you just click save and then you follow the guide to navigate to where you need to go next. So next on the panel, we're going to go to the access, jump down to access down here. Actually, I'm sorry, we're going to go back up here to the basics panel, and we're going to navigate to the sponsor and program information panel. In this sponsor proposal ID field, this is where you're going to copy and paste the sponsor protocol number directly from the sponsor protocol. So we want this to appear exactly as it appears on the sponsor protocol. I'm just going to put in a random number for this demo, but you're going to want to copy and paste directly from your sponsor protocol. You're going to click save. Next, we're going to jump to this access panel. Now this panel, you'll notice I'm the aggregator, I'm the proposal preparer here, so my name automatically appears here. This add user is only if you're going to add, if you want to click to add other people to a proposal that may require access rights. So if there was another person that was completing the proposal, if there was somebody else that needed to review or modify the proposal before it was routed for approvals, you would go ahead and search for that person's name, click continue, pull them up, and you can add them to the proposal. So this is totally optional. This is just if you need to add additional users that are going to have access to the proposal that maybe need to edit it further, you would do that here. We didn't make any changes here, so I'm not going to click save. If you did make changes, I would click save. From here, we're going to go back up to the key personnel, click on personnel section, and this is where we're going to go ahead and add our PI. So we're going to click add personnel. I'm just going to use Dr. Sanborn for this demo. So I'm going to type in Sanborn, use the asterisks to search. And there he is, William Sanborn. So I'm going to select his name, click continue. Now you want to make sure here for other types of proposals for OCGA, you might be adding co-investigators or key persons. For OCTA, you'll only be adding the principal investigator here, which it defaults to. So you'll just leave that selection alone, click add person. And as it's thinking, you'll see that it populated Dr. Sanborn here as our PI. If you click this little triangle or caret next to Dr. Sanborn's name, you'll see some additional information here populate. I want to point out that by adding the PI here, it triggers a notice to the Conflict of Interest Office. who will send a notification to Dr. Sanborn to complete his 700U, his submission to the Conflict of Interest Office, his financial disclosure. That's really important. You want to make sure that your PI submits their 700U to the COI office and that gets timely processed. OCTA won't be able to sign the contract until COI has cleared the PI. So I just want to make a mention of that. But really here, I just want to point out that the most important tab here, you can feel free and kind of click through and make sure the information here is accurate. But the most important thing here is this research questions tab. It's where you're going to find the research questions. We're not going to complete these now. You're going to complete these after we've gone through and really completed the proposal submission. It's recommended that once you've completed a proposal, you come back here and click notify your PI. By clicking notify, in this case, Dr. Sanborn receives an email that lets him know that, hey, he needs to come in here, review this proposal, and complete these research questions, and click yes or no to certify. If your PI is unavailable or has delegated this responsibility to you as the proposal aggregator, you can also come in here and complete these questions, which I will go ahead and model for you later so that we can demo creating and submitting this proposal. So I'm just showing you this for now, that this is here. We're going to come back and complete these research questions later. So for now, we're just going to click save, because all we wanted to do at this point was add Dr. Sanborn as our principal investigator. The next place we're going to go to is navigate to the compliance panel. And the first thing that we need to do is add a compliance entry for the IRB or human subjects. So we're going to select human subjects as the compliance type. This needs to be set to a pending status. Even if you have already, for some reason, submitted to the IRB, let's say it's been approved, the only status here that Kuali will accept at this stage is pending. So you're going to want to select pending. If for some reason the IRB had already approved or you were using a commercial IRB, you would go ahead and leave a note here. And then in the protocol number field here, you're going to want to enter the UCSD IRB number if you have it. So I'll just go ahead and enter a number here. This is really important. If you have a UCSD IRB number, that you add that number here. Another important entry to make in this comments box is if you are using a third-party IRB or a commercial IRB, we would ask that you go ahead and write commercial IRB here so that we know that you're using a commercial IRB. It's also helpful if you have not submitted to the IRB yet, you don't have a number, if you leave some commentary here letting us know when you intend to submit or why you haven't submitted, to kind of give us that background information to help us prioritize your study. That's helpful. So here we've selected human subjects. It says pending. I put a number in. We're going to say that we're using a commercial IRB here. I'm going to click add entry. So at this point, really all we need to add is a line for human subjects. The only other compliance line on this list that could apply for an OCTA clinical trial is potentially an export control line. If any of the export control questions in the research questionnaire were answered yes, you would be prompted to add an export control line. So I'll go ahead and demo that later in the presentation. So I'm going to hit cancel for now. We're just going to upload the human subjects line, which is going to be a requirement for every clinical trial contract proposal for OCTA. I'm going to click save. The next place we're going to navigate to is the attachments panel. And this is where you're going to want to upload that documentation, the sponsor protocol, the ICF, the draft contract, draft budget, potentially PI exception information that I mentioned earlier. And you want to click internal. If you weren't sure where to add these attachments, you could click this button for some help. But for OCTA clinical trials, you want to click on this internal tab and make sure you're uploading them here. You have two options for uploading documents. You can click add, and you can upload individual documents one at a time. That takes a little bit longer. I recommend that you click upload and add, this blue button, which allows you to select multiple documents and upload them at once. So I'm just going to upload some documents from this dummy file that I have created. So I'm going to grab my draft budget, contract, ICF, and I'm going to grab the sponsor protocol, click open, and you'll see that all of those documents are going to appear here. If you knew that your PI required an eligibility document or a PI exception form, you could go ahead and upload that at the same time. And so here, you just have to go through and update the type, status, and description, if applicable, for each of these file types. So this first file type that I uploaded is a sponsor protocol. We don't have a type that explicitly says sponsor protocol. These were kind of all out of the box options. And so the one that the proposal guide tells you to select for sponsor protocol is to choose other sponsor attachments, non-S2S submissions. So we're going to select that. The protocol is something that should really be in a complete status from the sponsor. It's not something that we're going to manipulate, so you can leave it to this default complete status. And then, of course, my file names are all neatly named. Yours probably won't be like that, so by looking at the file name, OCTA won't be able to tell what the file is, so we ask that you put here sponsor protocol so we know what that is. Come down here and update the file type for your next file, which is a budget. There is a type that says budget document, so we ask that you select that type. This should be a draft budget, so you can mark it as incomplete since it should be something that's to be negotiated. Since this already says budget documents, you don't need to type anything here since it's self-explanatory. We're going to go down to the draft sponsor ICF is the next file I've uploaded. Like I said before, although this is neatly named here, yours probably won't be. So you're going to come down here, and unfortunately there's no ICF option. So it's that same thing. You're going to select other sponsor attachments, non-S2S submission. The ICF is probably in a draft stage, so you can select incomplete. And we just ask you to enter ICF here so we know what document you're uploading. And then update our last file type, which is the draft contract. And there is an option for draft agreement, so go ahead and select that. Again, it's just a draft, so you can mark it as incomplete. You don't need to put anything here in the description box because draft agreement is pretty explanatory. We're going to click save. And so the next tab that we're going to go to here is we're going to come to the notes section. This is the only spot that we have for you to add department contact information. We'll know who the proposal aggregator is, but it varies by department. Typically, there's an additional study contact or an additional department financial contact that OCTA needs to include in communications. So we need you to add those people here. So if there are additional department study contacts, such as a study coordinator, we would ask you to put that person's name. Since it's a Sanborn, I know Christina Chickering is typically a contact. You would enter email address here in addition to the person's name and click add. If there was also a separate financial contact for the study, you would enter, say, Joe Smith is the financial contact, Joe Smith at ucsd.edu, put their email there, click add. So this is so OCTA knows in its communications who needs to be included from the department. Anyone who needs to be included from the department on OCTA communications needs to be added here as a department contact. Once you've done that, go ahead and click save. And we're going to navigate to the budget panel next. And to start a budget, you click add budget. This budget name is not super important. We suggest that you put perhaps the sponsor name and the protocol number. I'm going to just go ahead and put something here for a protocol number. But you can put whatever you'd like here. You're going to click Start a Summary Budget. For OCTA, you're always creating a summary budget, and you want to click Create Budget. Now it brings us to our budget period and totals table, and you'll notice that it pulls in the start and end dates that were entered in our early in the Create Proposal tab. If you had entered a date range that was beyond 1 year, you're going to see multiple lines here, multiple periods. You're going to want to delete those extra periods and revise the start and end dates in the beginning of your proposal and enter those new start and end dates here. Make sure that they match. This is why we instruct you to just put a 1 year time period at the beginning of the proposal so that you just have one line, simple, clean, reduced data entry. And so these start and end dates match what we entered in the beginning. It's 1 year, which is what we're supposed to do. So we're just going to go ahead here to the direct cost section and put in direct costs. This can just be an estimate. You can put in the direct costs that have been proposed by the sponsor in their draft budget, or you can enter what your department believes is an estimate of what they think it will cost to run the study or what they will ask from the sponsor. So I'm just going to put some numbers in here. F&A costs, this is the direct cost. I'm going to put some numbers in here. Again, these are just estimates. I'm going to click Recalculate with Changes, and it's going to add these two, and we're going to see the total sponsor cost populate here. The next place we're going to want to go to is to the budget settings to update some of these budget settings. Here you can mark the status of the budget to complete. Before you move on from this budget section, you have to make sure the budget status is marked to complete. You can do that in a couple of different places. I think it's easiest to do it here since you're already in this budget settings tab. So I recommend that you mark complete. The next place we need to go is this unrecovered F&A rate type. Unfortunately, it defaults to modified total direct cost, which is not the rate type for clinical trials. You want to select total direct cost, this TDC rate type. So both of these rate types need to be at TDC. And then there is no cost sharing applicable to industry initiated clinical trials. So you want to uncheck submit cost sharing and click apply changes. It's going to say, are you sure you changed the right rate type? It's going to recalculate. You want to answer yes, that's fine. We know we changed the rate type. And so at this point, we've updated the budget table. We've updated the budget settings. We want to click return to proposal. And you'll see it says status complete. If we go to this actions column right here, click action, we see this include for submission. We want to check include for submission, and you'll see that it turns green, which lets us know that it's been marked as included for submission. For the budget, you need to make sure that it's both marked as complete and included for submission, meaning you see this green color. If you don't do those two things, you'll be prompted with an error message when you go to complete your proposal, when you go to route it for approval. So we've done those two things. We're going to go ahead and click save. That's all we need to do for the budget section. Next, we're going to navigate to the questionnaire section. And this section is not to be confused with the research questions, which is a separate tab that's part of the PI certification section under the PI's name and key proposal. We're going to get to that section later. These aren't the research questions. These are the contact questionnaire and the space questionnaire. So the contact questionnaire is asking for a contact from the industry sponsor, or if there was a CRO contact, whoever is the applicable sponsor side contact that UCSD will need to initiate contract negotiations with. You want to put that person's name here. So we'll just say that's John Smith at Pfizer. So you want to click save. And then the space questionnaire is really important to fill out. The first question asks, will existing on-campus space be used? You select yes or no. If you select yes, it's going to ask you to list the on-campus space to be used. So we'll say that the ACTRI clinic is going to be used for this study. Will new space be required? You want to select yes or no. We're going to say no for this. I believe if you select yes, this is one of the critical criteria that will route your proposal to a department, DBO, or MSO approver. So keep that in mind. Will San Diego VA Medical Center space be used? You want to check yes or no as applicable. I'm going to say no for this demo. And then will existing off-campus space be used? For example, often in OCTA trials, Rady Children's Hospital is involved. If Rady Children's Hospital was involved, you would want to list their off-campus space. If there's any other on-campus space that applies to your trial, you're going to want to list it here. Otherwise, you're going to select no, which we're going to select for the purposes of this demo. Click save. The next place we're going to go is to the Supplemental Information tab. This is where you're going to search and enter the organization code for the lead department. And it's really important that this is done correctly. If you know your department's number, you could enter it. I don't know medicine, so I'm going to search for it. There it is, medicine. I'm going to select. Click save. You want to make sure that that org code is the correct org code for your lead unit. Otherwise, that will have downstream financial system impact. So at this point, OCTA recommends that you might want to run a data validation before moving on to the PI certification part, just so that you can correct any errors before you send this to your PI for review. And so how to run the data validation. Actually, so to run the data validation, you just go up here to data validation. It says data validation is currently off. So to turn it on, you click turn on. And it's going to think a little bit. The sandbox environment, which I'm in now, can be a little bit slow. Okay, so the one error that we know we're going to get is the investigators are not all certified because we haven't done that step yet. But we don't see any other errors at this point, which is good news. So you want to click turn off when you're done. If you saw any additional errors other than investigators haven't all certified because we haven't got there yet, you would click fix it and follow the instructions to fix it. We don't have any other errors. So we're going to click turn off. We want to turn off the validations because if you keep them on, it's going to constantly think in the background and slow you down. We're going to click close. And we're going to navigate to key personnel to go ahead and complete the PI certification, which includes answering those research questions. Now, for purposes of this demo, I am going to complete the research questions. But again, the recommended process is that you click this notify button to notify your PI who will receive an email with a link to come in and complete these questions and provide the certification. If your PI delegates you with this responsibility, then you would follow the steps that I'm taking here to answer these questions, including clicking the PI certification, clicking save, and your name will appear instead of the PI's as the one who certified this record. So in answering these questions, it's really important that you answer them correctly, as some of them will dictate the routing of this proposal, whether it routes to OCTA or OCGA. So this first question is just asking whether the activities here are human subjects research. And so if this is a contract that you want to go to OCTA, the answer to this question should be yes. It asks another question, is this research covered by regulations for human subjects research protection? Again, if this is an OCTA contract, the answer should be yes. So we're going to click yes. The next question, is this research covered by regulations for stem cell research? you answer this depending on the circumstances of your trial. For this purposes of this demo, I'm going to say no. Is this project covered by NIH genomic data sharing policy? You would answer this according to your trial. For this demo, I'm going to say no. And this is an important routing question. Does this project include a clinical trial? And if this is a contract that you are routing to OCTA, the answer to this question should be yes. And when you collect yes, you'll see a waterfall question opens up. And this question determines routing between OCTA and OCGA, so it's really important that it's answered correctly. The question says, has the external sponsor provided a study protocol for this project? And this question is really asking, has the industry sponsor for this project provided a study protocol? And the answer should be yes. If you select no, you're saying that no, there was no industry authored or provided study protocol for this project, indicating that it's investigator initiated and it will be routed to OCGA. So the answer to this question should be yes, an industry authored and provided study protocol has been provided for this project. So when you select yes, another question answers, and it gives you the option to request budget and development and negotiation services from OCAA if you desire. If you want OCA budget services, you click this first option that says I request OCA budget services. If you do not want OCA budget services, which is totally fine, it's an optional service, you would select the second option. And then there's this third option which says this is not an industry initiated and funded clinical trial, OCA budget services are not available. And this is meant to kind of alert you to the fact that if you're selecting this third option, then we probably need to come up here and revisit your answers to these questions because they probably were not answered correctly. Because if this is an industry initiated and authored clinical trial, then you are eligible for OCA budget services, and you'd either be selecting yes, I request budget services, or no, I do not want OCA budget services. So for the purpose of this demo, I'm going to say no, I do not want OCA budget services. The department's negotiating the budget. I'm going to keep moving. Animal research should not typically be applicable to an OCTA clinical trial. I'm going to select no. You would select these health and safety, answer these health and safety questions, which for OCTA clinical trials is typically no. And this is where you have the export control questions. You're going to want to answer these according to your project. If you select yes, a popular situation that arises for OCTA clinical trials is if you have a sponsor that is located outside of the US, meaning you're working with a foreign entity, you should be selecting yes, and then answering these questions accordingly. And so for the purposes of this demo, we'll go ahead and select yes. We'll say yes, there is an involvement of a foreign entity. What country will you be working with? We'll just go ahead and say that it's a German company. Is there collaboration with research in Cuba, Iran, North Korea, Syria, or Sudan? You would select yes or no. We're going to say no for the purposes of this demo, and then continue to say no for all of this, which typically does not apply to OCTA clinical trial. And then the last thing is the certification. And so I'm going to say yes, I certify this. I'm going to click save. Now you'll notice up here that it says certification completed and answered by, and it has my username here and it has the date and the time. So if your PI was the one who certified this, it will be answered by them. But if you were delegated and authorized and told to certify and you chose to certify on behalf of the PI, you'll see that your name will appear here with the date and time stamp for that. So at this point, after the research questions have been completed, there's been a certification provided by the PI, you're ready to go ahead and submit this proposal for review and approval to the sponsored project office. In order to do that, you're going to click submit for review. When you click submit for review, it's going to automatically run the data validation. And so we should be getting an error message here because we answered yes to that first export control question asking if we were working with a foreign entity, and I did not add a special review line for export control. So like it says here, answers to questions indicate export control related activities are occurring, but you did not add an export control compliance check. So I'm going to click fix it to go ahead and fix this. It's going to bring me back to the compliance area. And so now we're going to hit add compliance entry to add that export control line. Select export control. The approval status here, just like human subject, should always be set to pending. And here we would just ask you to leave some comments explaining just very briefly what prompted the export control review line. So here we'll say, you know, industry sponsor, headquartered in Germany. Add entry. I'm going to click save. Now, if you had answered no to all of those export control questions, we would have been good to go and nothing should have popped up. The reason that we received that error is because when we were answering the export control questions in the research questionnaire, I answered yes to one of those questions and had not added an export control special review line, which I just did here. So now I'm going to navigate back to the summary and submit panel here on the left, and we're going to try submitting this proposal for approval again, and we should be good to go and should not receive any error messages this time around. So if you want to review what you've submitted, you can do that here. You'll notice this proposal summary tab has all the details that we entered on that first page. You can go ahead and navigate through the different tabs if you want and just confirm that you have everything. If you go to attachments, you have to click internal to see the attachments, click notes to see that you've added the department contacts. So feel free and kind of quickly skim through what you provided if you'd like before you hit submit. Once you're ready to submit, you want to click submit for review. You're going to get this question, do you want to receive future approval requests? This isn't going to apply to most proposal aggregators. If you were added as an additional, for example, if you were a DBO who was submitting a proposal in Kuali and there were also critical criteria that were selected as part of the proposal, meaning either the PI required a PI exception or there was new space being used, and you were required to be included in the approval routing as a result, meaning you're going to be asked to approve this proposal twice. It's asking, do you want to receive future approval requests? If you say no, the system will not prompt you for approval again. It will assume you approved. If you click yes, it will prompt you for approval. Again, if you're just a proposal submitter and you're not also located somewhere later on in the approval routing, it's not going to apply to you. So I recommend just clicking no. And it's thinking, and hopefully we get a successful submission. The sandbox environment can be a little bit slow. And so here you'll see in the upper left-hand corner, it says document was successfully submitted. You see the color under these bars here indicating the progress of the proposal. So right now, this blue color under the routing section indicates the proposal is now in routing. And you'll want to go down here to the view route log link, click on that and just confirm who is in the routing log. So when you open it up, it's going to show you the initiator of the proposal, which should have your name. I'm the initiator of this demo proposal, so it has my name. If we scroll down here, it shows that I saved the proposal, I completed the proposal. And then because we're in the sandbox environment, it's blank in this future action request. But in the production environment, when you're submitting a real proposal, you should see here the applicable SPO office approval stop. So if you've followed the directions in the OCTA proposal guide, you should see OCTA SPO approval stop, and it should appear down here. If there are any other department approvers that are triggered to be in the approval chain because maybe your PI requires a PI exception or new space is being used, you'll see those people's names here in the department routing. Or if you've chosen to add additional approvers, department approvers to the routing per perhaps a department policy, you should see those people's names here. Please keep in mind that as the proposal aggregator, it's your responsibility to ensure that any additional approval stops that are required before the SPO approval stop, that those approvals are timely given, and you need to monitor those and make sure that those approvers go in and timely give their approval, and that proposal makes its way to the SPO approval stop. So I'm going to go ahead and X out of this. Once you click submit, you should receive an email notification from Kuali notifying you that your proposal has been submitted and is in routing. When you're all done you viewing the route log and you're ready to get out of the proposal, you want to make sure that you click close and exit properly. Don't just click X or X out, otherwise you can create a proposal lock. You want to make sure that you click close. I also want to mention that I have extra access and permissions as a super user. So I see the submit to sponsor, button. I don't believe that you all will see this button on your end. You just want to click submit. So don't worry about what you see on your end. Might look a little different than what I'm seeing on my end. I see this button because of my super user permissions. In your case, you just hit submit for review, which we just did. And once that's done, you see that it's in routing, it's been successfully submitted. You want to go ahead and click close to exit the proposal. So that concludes the step-by-step instructions for submitting a new contract to OCTA and Kuali Research. If you have any questions, please don't hesitate to reach out to us at octa@health.ucsd.edu. Thank you.